Hello, everybody, and welcome to Waiting Room Entertainment, who asked us to do a video to celebrate Scleroderma Awareness Month. And everybody knows pretty much, I think, who I am, and I'm Lesley and Saketkoo, and folks generally know me from patient conferences and videos, and usually I'm focusing on exercise and self-empowerment. But today I really wanted to focus on research, and I've invited today to join me is Mr. Reggie Mister from Delricht Research, who is the regulatory and contracts manager there. And he's a very important person in the scleroderma clinical trial and research landscape, because he's somebody that makes it possible, and somebody that I'm very grateful is my colleague. So welcome, Reggie.
Yeah, thank you. Thanks for the lovely introduction. As Dr. Saketkoo said, my name is Reggie, and my focus areas in research are regulatory and contracts. Within those, definitely I found specific interest in patient advocacy and centricity. And Dr. Saketkoo and I worked on some pretty neat trials and with a focus on the patient. So happy to be here. Happy to celebrate this awareness month. And happy, to be invited to this video.
Thanks, Reggie. So tell us just to give folks an idea, because I guess in everyone's mind, when we say research, folks thinks of like a mad scientist at the bench with tubes everywhere.
Right.
What are we talking about, and why are we bringing this up to patients? We're talking about a specific types of research.
Yeah, for sure. So, we're talking about research. We're, talking about clinical trials. When we think of clinical trials, typical layout of a clinical trial is the patient being, categorized into two groups, the placebo group and a background therapy group, where the patient is receiving what we call the study drug or investigational product. Usually, these studies last between 6 to 12 months, and we often see them lasting for a year. Sometimes they have a open label extension, where even if you received placebo earlier on in the clinical trial, you're guaranteed to receive the study drug, which is we love that study design.
Yeah, we love that study
design. Typically, patients can expect to have visits between every 4 to 6 weeks. And what we really focus on here with Dr. Saketkoo is making sure the patient receives a adequate fair market value stipend that covers their time and effort for participating in that trial. So we're covering the time they're spending for work, and we're covering the time they're spending, time and money they're spending traveling back and forth from our research site.
Very helpful to give people an idea. And I guess one thing that I would say is that research benefits everybody in the short term and in the long term. Even if somebody gets placebo in itself is effective, right? So exactly. I mean, that's a tall benchmark, because the human spirit, we've got a lot of chutzpah, I guess. So placebo is estimated to be something like 33% effective. So a study drug being much more significantly higher is really telling us that that's effective. But even though that placebo in itself is effective, just the fact that somebody's part of a clinical study has been demonstrated to show that those folks actually do better, probably because they're getting more close follow-up to care, possibly because they're learning more about their health condition, and they have more frequent contact, hopefully, with their clinician, and they feel more cared for. So that's even if they're not getting the actual study drug. And then the other thing is that knowing that you're contributing to something greater, science, the greater good, knowing that somebody in the future is going to benefit from your actions, that has also been demonstrated to show that that improves health and health outcomes, being that generous with your life and yourself. And so it's really a win-win. And as long as somebody's appropriate for a study.
Right.
And so so in terms of where patients might find out about being part of research, because when I go to some patient conferences and I start talking to folks about being involved in research and looking out for research near them, I often hear back, well, no one's ever brought it up to me, which is very odd for somebody that has a rare disease that we're not, I mean, very commonly people with cancer, they're shuttled into clinical trials, but we're still having a lot of trouble in the realm of autoimmune diseases and other rare diseases. What might folks do to get involved?
Yeah, I mean, as you mentioning, clinical trials is very prevalent in the cancer space, not as much in the rare disease space, and that's something that we're definitely trying to change and bring more attention to. So a good place to start is clinicaltrials.gov. This website here is a government website, and it lists out every study in the United States that every clinical trial that's currently happening in the United States, and usually offers the patients some information on that trial, as well as how to get in touch with the center that's running the clinical trial. I know, Dr. Saketkoo, you do a lot of work with Scleroderma patient centers, and that's a great way to find out about studies as well.
Yeah, so that's very true. So patients can ask and to be referred to a Scleroderma center or to be cared for by a scleroderma specialist, along with their local rheumatologist, general pulmonologist. And the Scleroderma Center will share care and communication and help both the local physicians and the patient on this journey to living your best life with scleroderma and what that means. And Scleroderma centers are participating usually in several clinical trials related to scleroderma. And the other thing about being at a scleroderma center when you're looking at clinical trials is that the scleroderma specialist really has their finger on the pulse. First of all, knowing who's going to fit the profile for what clinical trial, but actually whether or not a clinical trial is going to be safe for that person based on their disease activity and how they look, because maybe somebody's disease is too active and they need to be rescued. Maybe the safest thing is for them to be rescued before beginning the clinical trial with more advanced therapy that we know can make a difference. So, so there's a lot of decision making on that level. And then I guess the other thing is patients, talking to patients on social media. That's been really important. And I have to say that patients save other patients' lives, not just about getting people into a scleroderma center near them or in a city that's easy for them to get to, or a city they have family in, but also just the discussions around, well, you might have scleroderma, or so patients are raising awareness about scleroderma. And that's what I mean, that patients are saving lives, because patients are getting other people who possibly have scleroderma into early treatment. And that has been absolutely powerful in finally beginning to diagnose patients at an earlier phase of the disease, whereby treatment really makes a difference in the early stages.
Yeah, that's a great point.
So was there anything else that we wanted to say, Reggie? Have we touched on everything that we thought we might want to say?
I believe so. I think, in closing, I'll just reiterate the importance of, research, especially into rare diseases at this point in time. Happy to be here, happy to continue this conversation with you, Dr. Saketkoo. Through working with you, I've been exposed to, a lot, of rare disease and the challenges thereof. So happy to be, a part of this.
Thank you, Reggie. Really fantastic. And more about this in our second video of the challenges of rare diseases in research and what we can do as advocates.
Part 2.
But in part 2. Thanks so much, Reggie, for joining me.
Absolutely.
And happy Scleroderma Awareness Month,
Yeah,
everyone.
happy Scleroderma Awareness Month.